Hello and welcome to our endoscopy service, and we hope that this video helps you to prepare and reduce any concerns that you may have. Having an endoscopy means that we use a camera to examine your gut, to diagnose a specific problem or to provide treatment. This is an outpatient service, which means that you will be in and out of hospital on the same day, and most of our patients are only with us for 2 or so hours while we undertake the test and they recover. You may need to take specific medicines and starve for several hours before the test, and this will be explained to you in clinic or by telephone. This is called pre-assessment. When you come to your endoscopy appointment, please bring a list of any medicines that you are taking, including homeopathic remedies and drugs purchased from a pharmacy. If you choose, you can have sedation to make the test as comfortable as possible, but you will not be able to drive for 24 hours after the procedure. You will therefore need to arrange for transport to and from the hospital. We recommend that you have someone with you to keep you company and also to make sure you are okay when you get home. You will also need someone to be in the house with you overnight. Before the procedure, one of our nurses will explain what will happen, check your blood pressure, and ask you some questions about your health and medications. This is a good time to ask any questions and discuss your concerns about the procedure. The specialist doing your test will ask you to sign a form called a consent form, which gives your agreement to the procedure. Having a colonoscopy involves having a small tube passed into your lower bowel. We know that this is a strange experience, but is one that we do many times a day and is very safe. You can choose to have some mild sedation, which will make you feel relaxed and sleepy, although you won't be completely asleep. If you choose to be sedated, we will inject the drug in your hand or arm through a small plastic needle called a venflon. If you choose sedation, you will also be given oxygen through a small plastic tube in your nose. Alternatively, we can carry out the procedure without sedation, but you can have a gas and air mixture which will help you relax. Before all of this happens, we will do a safety brief when we double check your information and do our final checks. During the procedure, our team will explain what they are doing, and you can see the inside of your bowel on a television screen if you wish. You may be asked to lie in different positions in order to keep you comfortable, and we will monitor your pulse and oxygen levels. Normally the test takes about 30 minutes, and afterwards you will go to the recovery area on a trolley. When appropriate, we will give you some refreshment. We will also explain what you need to do if you feel unwell when you get home, but this is very unusual. Before you leave, we will go through your test report with you. These will be sent to your GP, or a specialist will arrange a follow-up appointment with you to agree the next stage of your care. The majority of our patients sail through the test without difficulty, and if you have any concerns or questions, please do ask. We will be pleased to help.